Hi, my name is Rodney Palmer. I'm a veteran Canadian journalist, and I'm here today talking with Mr. Frank Clegg. Frank is the CEO of a group called Canadians for Safe Technology. And quite notably, prior to this volunteer effort, Frank, for about 14 years, ran Microsoft Canada. And he is considered one of the great technological leaders, a technological executive in our country and throughout North America. And for the last almost a decade, Frank has been leading a volunteer effort called Canadians for Safe Technology. And I just want to welcome you here today, Frank. Thanks so much for meeting with me.
Well, Rodney, thank you very much. I appreciate the opportunity.
I think a lot of people wonder why Mr. Frank Clegg, who hit the technology lottery in the 90s and joined a new company called Microsoft, ran it for 14 years, got to retire in his 50s, is spending his time educating people about safe technology. Why are you doing this?
Well, Rodney, my journey started almost a decade ago, where because I was retired, I had the opportunity to meet with experts from around the world, experts from organizations such as Harvard, Yale, Columbia, University of Toronto, McGill. I had the pleasure of meeting with one of the lead scientific writers for Al Gore's team that won the Nobel Prize, and with Dr. Anthony Miller, who a Canadian epidemiologist who has been awarded the Medal of Honor from the World Health Organization. And after my extensive research and analysis with those folks, I've come to the conclusion that our implementation of wireless technology is just simply not safe. And I co-founded C4ST, Canadians for Safe Technology, to help raise awareness among Canadians about the potential harm, how to use the technology more safely, and also to raise awareness and help government regulation change to better protect us from the harmful effects from wireless devices.
So this is primarily the wireless, the sort of the microwave radiation signal portion of the technology, and you're not so much focusing on the social media or the advent or the absolute full consumption of technology in our lives, but it's the delivery, right? As opposed to plugging it in with a wire and getting the internet. It's about the microwave radiation.
Yes, absolutely, Rodney. There are hundreds and hundreds of peer-reviewed, published studies in high-quality scientific journals that show there is absolute harm to individuals and to our environment from the wireless radiation emitted by cell phones, tablet devices, Bluetooth headsets, and the cell towers and Wi-Fi routers that are used at the infrastructure to support these devices.
What kind of harm are we talking about?
Well, the early symptoms, and everybody has different reactions. Some people might get a slight headache and not realize that it could be coming from the radiation. It may or it may not be. There's dizziness, lack of sleep. We hear a lot of people talking about that. And some people, more extreme people, you may even find a numbness or a tingling in their hands and their arms, tinnitus, a ringing in the ears. So it really depends on, everybody's reaction is different. Some people minor. Some people, unfortunately, it's debilitating enough where they can't go to work. Sometimes they have to move out of their apartments if there's antennas on the roof. So there's a wide range of minor impact up to significant impact that could be debilitating.
And I'm aware that you've been lobbying government. Your group has gone to Ottawa. You've spoken with the Standing Committee on Health on a number of occasions. I mean, this is legendary work that you're doing, in my view, on behalf of Canadians. It's absolutely fantastic. And I understand today, in the midst of this snap Canadian election, that you want to try to empower Canadians to do something about that, to speak up about that, to talk to their politicians about this issue. What do you want them to do?
Well, Rodney, we're asking Canadians to help us basically find a champion member of parliament to help bring this issue forward with their fellow MPs and also with the appropriate ministers, the Minister of Health, the Minister of Industry and Economic Development, the Environment Minister, the Finance Minister. So this campaign is asking for Canadians to go to our website, c4st.org/candidates who care. We're looking for candidates who care about Canadians' health to sign up now and say, if I'm elected, I will help raise awareness in Parliament and implement the recommendations from the Parliamentary Health Committee. Back in 2015, we had the opportunity to work with committee members, a Liberal health critic, a Conservative member in our local riding, and the NDP health critic, and they dedicated 3 days of testimony. They heard from international experts, some I mentioned, McGill, from Columbia, Harvard, Yale, They heard from industry, they heard from Health Canada, they heard from Industry Canada, and so they heard a whole spectrum. And they came out with 12 very solid recommendations. The recommendations received all party support. All parties supported it, and the recommendations were tabled. And unfortunately, Health Canada has basically almost completely ignored the recommendations. So we're asking for members of Parliament or candidates in the 44th election of this campaign to sign on to our website, Candidates Who Care About Canadians' Health, and help us raise awareness and get these 12 recommendations fully implemented. That's really what we're asking Canadians to help us to do.
There's a couple of things that really strike me there that you say. One is that it was 2015, so 6 years ago. You have a multi-party committee, like all committees in Parliament. It's how the Canadian Parliament works. The parties represented and distributed based on the election of that term will make up a committee proportionally. So you're telling me that all parties agreed to this in 2015. Why hasn't anything happened?
Well, Rodney, there's a lot of speculation. I think, to me anyways, one of the biggest issues is that according to our calculations, the federal government has gained about $20 billion in selling the spectrum licenses for wireless radiation. So I would argue that could be 20 billion reasons of conflict that the government has in terms of not acting. It's also possible that the lead scientists at Health Canada involved in the radiation spectrum and the analysis and the guidelines have written papers. So their personal reputations are attached to this issue, saying there's no harm. And it could be that their egos are attached to it as well. It's hard to speculate. Yeah, the other thing I think it's really hard is that we're talking about infrastructure here, right? And infrastructure, in order to do it properly, you have to spend a lot of money up front. And so there is an amazing alternative called fiber, and fiber can work for the majority of implementations. And so the government is focusing on expanding internet to all of Canada. Unfortunately, they're not spending enough time on fiber. And so it's really hard.
My understanding that it's your position that fiber is safer because it emits no microwave radiation. And let's just be clear that the Wi-Fi, for example, operates, from what I understand from your site, on 2.4 gigahertz, which is the exact same frequency that I use to cook food in my microwave. So that I can kind of get, that I don't want to be exposed to even a little of that. And fiber optic gives you the same connection with the internet, all the same information. As I understand, it's more secure because it's more difficult to hack, for example. But to lay down fiber across the country is a monumental task going forward for the future of internet connectivity compared to putting up some towers. For example, when I was foreign correspondent for CTV in India, I couldn't get a phone in my apartment, but I could get a cell phone because the infrastructure for regular telephone lines was so far behind in the rural areas that when cell phones came along, they could put up a tower quite easily. And in fact, in 1996, when I was there, they were probably 5-10 years ahead of North America on who was using cell phones, texting, all what they were doing with their cell phones. So I get that it's easier and it's cheaper to do it. So why wouldn't we do what's easier and cheaper?
Well, because in the long run, it isn't cheaper. It's actually more expensive. And so very similar to the investment that we made in the railways back, decades ago, we need to make that investment today. Not only is it not cheaper and it's greener, we know that a wireless infrastructure uses 10 times more energy, Rodney, than a wired infrastructure.
10 times.
10 times. And we know.
So that's why it's greener to have fiber, is you're not using hydroelectric power.
Absolutely. And so it's interesting you mentioned India. A few years ago, India passed legislation nationally that their guidelines are 10 times safer than the guidelines Health Canada is using in Canada right now. So yes, India was ahead of us on the technology. They're also ahead of us, way ahead of us in terms of protecting their citizens more than we are. It's also more reliable. A fiber connection is in the ground, it's buried, as opposed to a tower that is subject to rains. It's more resilient. You can get at it, you can access it. And so, the fiber structure. So back to your question, it's very difficult for a politician in a minority government environment who could be running for re-election in 2 years to make a commitment or make a recommendation, or as a minister, make a decision to invest in fiber, which is more expensive up front And we won't see the benefits of that until maybe 4 or 5 or even 10 years from now. So it's difficult for politicians to make that commitment and to have that vision that we need in terms of supporting this fiber as a potential solution.
Well, one of the great concerns of every politician is the cost of healthcare in Canada.
Yes.
I've heard it described 20 years ago as bankrupting policy, that eventually we just won't be able to pay for it. So has there been a cost benefit analysis between the two? You're telling me that there are serious health problems that can result from this. Now, you talked about symptomatically, people can't sleep at night. Maybe they could just turn off their Wi-Fi at home and see if that helps. Turn their cell phone off, don't leave it running beside their bed all night long. Simple little things. But I wonder if I'll give you a two-part question, and I really hate the two-part question, but here we go. Can you tell me about serious health problems that are documented and scientifically accepted to be occurring because of this? Maybe something that's on the rise concurrently with the advent of cell phones, cell towers, and Wi-Fi. Yes. And secondly, is that, as a CEO of Microsoft and a mathematician and an economist and all that you are, can you think of the cost benefit analysis between the two? Has it been done? Has the total societal cost, including healthcare, been factored in here?
Oh, let me answer them in the order you gave. There is absolute rock solid scientific evidence that shows links to cancer. We have a study done, now a $20 million US government funded study by the National Toxicology Program that analyzed thousands of rats and mice and came back with their highest category, clear evidence of cancer and clear evidence of DNA damage.
What type of cancer?
It's a cancer in the heart. It's called a schwannoma, so it's cancer in the heart. And the reason we use rats and mice is because they're a good basis for future work. Scientists will ethically intentionally expose people to radiation to see if they have cancer. We also have epidemiological information. Sweden has some of the best cancer data and cell phone data that they can correlate the cancer data with the cell phone usage that proves, and there's many papers written by experts. Dr. Hardell is one of the leading experts that shows an absolute categorical link between brain cancer and the use of cell phones. And Rodney, the use of cell phones is like measured in not even an hour a day where they're seeing these significant links. So to answer your question, number one, we have links of cancer, DNA damage, peer-reviewed published studies that show damage to male sperm. We're showing links to autism. We're showing impact on childhood education and development. So we are seeing this, and we're seeing the increases. The American Cancer Society has talked about the increase in brain tumors that are showing up not only in the general US and adult population, but in children too. So we're seeing that increase. We're seeing the huge increase.
Pediatric brain tumors.
Yes. Yes.
It's stomach churning to know that this science is out there and it hasn't worked its way up through the machinations to get to public policy. And the intersection between emerging science and public policy is always a very slow one. Yes. That collision course happens in slow motion. If you look at acid rain, for example, something that was understood by scientists in 1972, it took a decade and a half to turn into legislation. Now, with the wireless, the thing about acid rain is it's kind of gross. It wrecks our lakes. The thing about cigarette smoking is it's kind of gross. It kills people and it smells up the room. The thing about wireless technology is it's bloody awesome. It lets me connect to my phone anywhere. How do you combat the extreme convenience? Although death by convenience is certainly a conundrum of society today. But how do you combat that on a person by person level when they're thinking these things are great?
Well, Rodney, one of the recommendations, the 12 recommendations that the parliamentary committee came up with and tabled in Parliament in 2015 was to raise awareness among Canadians, especially children. And CBC did a study, the CBC Marketplace program, where 80% of Canadians were not aware that holding the phone to their head or putting it in their bra or their jacket pocket or putting it in their pants pocket actually broke the guidelines. We can talk about whether the guidelines are accurate or protective enough, but even it breaks because the cell phone to your head breaks the guidelines. So
these are the guidelines that I understand that are outdated by 40 years and require your skin to increase by 1 degree Celsius.
Oh, yeah.
Even that was being exceeded?
Yes.
So they're being cooked like the microwave. I was right.
By 3 or 4 times. So not by a little bit. They were 4 times more above the legal limit. So what we're saying is first of all, use the technology, keep it away from your body. Second thing is when you go to sleep at night, make sure you're in a radiation-free zone. Turn off your cell phone or put it in airplane mode. Turn all the antennas off because you now have 3 or 4 antennas in each one. Turn the router off or put it on a timer. So when your body, like our bodies are amazing, especially children's, are amazing healing and growth machines. So if you give your body that, 6, 8, 9 hours of sleep, where you're completely unencumbered and unimpacted by the impacts of radiation, your body can actually heal and help repair itself. So that's that's part of what we want to do is raise awareness. And the other thing is, I think if the average Canadian understood that bombarding yourself consistently while you're in your home, you would put up with, like most cell phones now and tablets have a connector that can go in the power port or some port in their phone where you can run a cable. And I think if most Canadians understood the potential harm to themselves and their family, they wouldn't mind plugging that cable in to their phone while they're using their phone. And you can have all the functions using that cable. I think people would run that Ethernet cable through their walls or along the baseboards and not have exposure to Wi-Fi. People find it amazing that I spent my 40-year career in the technology industry. I've never had Wi-Fi in any home that we've ever lived in. Never.
Well, thanks to you, neither have I. And as you can see, I live in a house that's made of logs. That's not easy. You got to run it along and you put a little piece of trim and too easy. There's no Wi-Fi in the house. We sleep like babies out here. Yeah. So back to this, the recommendation, one of the recommendations of this 6-year-old ignored, unanimously approved by every party report to the Standing Committee on Health is that we try to educate families, children about how to use technology, but use it more safely. That's awesome. Unfortunately, it's not being done. What about this 40-year-old outdated standard that was designed for microwave ovens in the 1970s, and now I've got one on my head? Was there any recommendation about this Safety Code 6?
Yes, the committee made 3 specific recommendations for Health Canada to change its process. Health Canada has never completed a thorough review of the scientific evidence that meets international standards. They have never done it. So the committee.
How do you mean international standards?
Well,
like
there's a
process.
Yes, the whole process.
You're reviewed and all that.
Yeah, you have to review it. You have to have an independent body. The last time they did it, the formal review, they had 8 committee members. 4 of them had connections to the industry. A couple of them that had on their website, you could calculate they received $400,000 in funding from industry. So those are 4 of the 8 committee members. So you need an independent committee.
So wait, the cell phone industry is funding the study that's designed to determine whether their products are safe for us.
Rodney,
this is what's going on in Canada?
Oh, it's going on all over the world. In fact, there was a study written by Harvard, an analysis by the Harvard University Press, that called the Federal Communications Commission in the US that's responsible for this, the most captured federal agency because of the links. Health Canada gets funding from the industry, the research, 2/3 of the research that is industry funded. Sorry, of the research that's done, 2/3 is funded by industry, and almost all of that research shows there's no harm. The only funding or studies that show that there's harm from wireless devices and the radiation from them is from independent research. And we're seeing less and less of that. 3 of the recommendations from the parliamentary committee was for Health Canada to do its own research, independent scientific research. So Health Canada is relying on research that's funded by industry because they summarize what their research is. They're basing the fact that it has to heat tissue to harm it. The first time that theory was published, Rodney, was 100 years ago. So Health Canada is using a theory that was first published a century ago, and they will not get off of that. They do not go through the proper process of going through. You do a search analysis, you summarize what the reasons that you're eliminating the research, and then you do a weight of evidence analysis. So you say, okay, here's a bunch of studies that show harm, here's some studies that don't show harm, and you analyze those, and then you publish that analysis. They have never, ever published the details of their analysis. So what we're saying, and what the committee, more importantly, these members of parliament from all parties in their formal report to the House of Commons said, Health Canada, you need to do this analysis, and you need to do it the proper way that international standards demand.
It sounds to me that it is so corrupted, as if maybe they don't mind that we're still using this ancient system that's outdated and not designed to really show us the truth of what's happening. It's like the system is designed to keep the truth out of the room.
Rodney, I don't know, as I said before, I don't know whether it's corruption. I don't know whether it's personal bias.
I didn't say corruption, but corrupted. Like the system is broken.
The process is absolutely broken. There is no doubt about that. We had experts. We actually had 50 Canadian physicians write to Health Canada saying, please update Safety Code 6. It doesn't protect our Canadians. Safety Code 6 are the guidelines around wireless radiation and what's safe. We had 50 international experts, scientists who do research in this field, write to Health Canada saying, please update your Canadian guidelines, because they do not protect Canadians, and they especially are worried about children. We have 250 scientists from 40 nations around the world who put their names and their reputations online in a formal appeal to the United Nations, to all of its member states, and to the World Health Organization, saying we're very worried about the damage to the environment and to people around the world. Please update your guidelines. And we just don't seem to be able to break through. That's why I'll go back to the campaign, the commercial for the.
Yes, because it sounds like, you know, you've got it's unbelievable, the pedigree of your campaign, and yet it's falling on deaf ears. There's willful neglect. There's willful blindness, perhaps. It's not working. So let's get, what can the average Canadians do to jump on this campaign during this election? And I will say there's a lot being talked about in this election, and almost none of it is the 5G rollout, which it seems to me could monumentally affect the health of Canadians for the next 50 years, maybe 100 years. What can they do? What do you want them to do?
What we want them to do is to very simply go to c4st.org, go to our Candidates Who Care webpage.
That's CanadiansForSafeTechnology.org. C4, it's the number 4.
Yeah, C number sign 4, st.org.
C4st.org.
Yeah, and go to that website, click on Candidates Who Care. There's a webpage for that. There's right on the bottom right-hand corner, there's a volunteer section. Read the letter that explains what we'd like you to do. Phone the candidates running in your campaign and ask them to sign up as a candidate who cares about Canadians' health. We will post their name. On Monday, we're going to be posting, I think we've got about 24 candidates who've signed up already. Most of the represented from the majority parties are represented. So we'll have that list up on Monday. But we'd ask you to go to electionscanada.ca. Elections.ca is the website. Get your candidate information, or you may already know it, and phone that campaign office and say, you have a letter from C4ST, an email from Canadians for Safe Technology. Please have your candidate read it. And please ask your candidate to sign up as a candidate who care. Candidates who care can go right on our website and sign up as a candidate, and we will post their name. And just before the election, as you'd expect, we're going to reach out to our network. We have 30 organizations that we network with across Canada. We have over 20,000 Canadians who signed the appeal. We're going to go out to them and say, as you're deciding on your election, or making a decision on who you want to represent you in Ottawa, we'd ask you to consider supporting the candidates who said they care about our health and will support the recommendations from the Parliamentary Health Committee. So c4st.org, candidates who care, go there, read we've even provided a script, Rodney, that people can use, a couple of suggested scripts that if they want to call their campaign office. We need to find MPs who are champions, as I said at the beginning. We need to find MPs who are visionaries, kind of like the MPs who supported the infrastructure for railways back decades ago. We're still seeing the benefit of that. We need the MPs are going to sign up and say, us, we need to go fiber first. We need to educate Canadians. We need to educate Canadian physicians and all health professionals. And we need to change our guidelines because we're simply not being protected. China and Russia have guidelines that are 50 times safer than our guidelines in Canada. I just find that to be just pathetic. And so please help us get candidates who will sign up, and help yourself. This isn't just Canadians for Safe Technologies request. Help yourself, protect yourself better, protect your children, and help us get candidates to sign up as candidates who care about Canadians' health in this election. We'll post their names on the website and hopefully get several MPs elected who will move this issue forward with us.
Well, that's a noble campaign, and it sounds to me that's a fairly reasonable ask. You're simply asking them to pay attention to a 6-year-old unanimous recommendation by the party that they belong to. If all of them signed on to it, then every candidate is represented in agreeing with it, technically.
Yes.
But I wonder, 6 years later, are those recommendations enough?
Well, Rodney, they're absolutely a great place to start. You know, we talk about not only education and awareness among Canadians in general, but on the medical profession. In Australia, there are guidelines. Sorry, Austria, there are guidelines that a physician can ask questions. You know, you talk about symptoms, a list of 20 different symptoms that a physician can be looking at. As we roll out Wi-Fi in schools more and more across Canada, we're getting reports from parents are saying, you know, my child was fine in school, and now they go into that Wi-Fi environment, and they just, one child explained it to her mom. He said, her parents said, Mom and Dad, I feel like I go into the school and I have brain fog. I can't think. And I come out of the school and I come home and I'm fine. So, you know, let's educate educators, and let's educate school trustees. Let's educate parents and grandparents and about not only about children, but the work environment. Let's educate employers to say, run that fiber to the building and run fiber throughout the building. So education and awareness. There is a percentage of the population that are electrosensitive. Let's understand that it could be as low as 3, but reports show as many as 10% of Canadians. That's 3 million Canadians that are suffering from the effects of wireless radiation. The majority don't even know about it. They don't even know turning that router off at night, getting that phone out of their bedroom can help them. You know, we talked about Health Canada's process, improve the process. So, you know, is there enough? Clearly, we'd like to see more, but let's start with some fundamentals. If Health Canada improves its process and does an analysis of the science properly, there will be changes made to the guidelines, 100% guaranteed. So let's start with that. You know, earlier you asked me about, you know, the economic analysis. All we see is industry propaganda and hype that says there's trillions of dollars of benefits, thousands of jobs. Nobody that we can find has done any analysis of the health effects, the lost work productivity, the climate impact. You know, there's a potential impact and a degradation on our ability to forecast weather accuracy as we roll out more of these satellites. So our ability to prepare and prevent damage from weather calamities is going to be impacted. Privacy and security.
Well, it sounds like there's so much that it's a really a fantastic campaign that your organization is doing. And it really empowers Canadians to do something where they don't necessarily have to wrap their head around this whole concept. They can do something as simple as pull their Wi-Fi out at night, turn their cell phone off at night, see if they sleep better. Say, hey, maybe Mr. Clegg's group has got something there. And there's a document that's been studied heavily that's waiting to be adopted. So your campaign gives voters a chance to do something. And that's really a gift to Canadian votors.
Well,
so,
the fact that it's gone through, sorry, right now you're saying the report is written and published and presented to the Commons already. So now we're saying to candidates, help us get it implemented. We're not asking for a big study. The study was done by the committee.
The work's been done. Just do it. Just start implementing what you already said yes to 6 years ago.
Yes.
It's a reasonable request. Frankie, thank you so much for spending this time with me today. I just want to direct people again to your site. It's C4ST, the number 4.org. And they go down to the bottom right-hand corner and they can find out all about it. Yes. Thank you for your time today, Frank. I think it's been very enlightening, certainly for me. And for all of you watching, I've been speaking with Mr. Frank Clegg. He is the CEO of Canadians for Safe Technology. Notably, he ran one of the biggest companies on the planet, Microsoft Canada, for about over a decade, over almost 14 years. And Frank knows just a little bit about technology. He knows a lot about technological safety. He's a great leader for this particular cause. And it would be worthwhile to take a look at his website, c4st.org. Thanks, everybody, for watching today.
Thanks, Rodney. Appreciate it.